come in.
Hi, how are you?
Hi, how are you?
Pretty good. My name is Omar. I'm going to be your nurse for today.
Hi, Omar.
Hi, can you verify your name and date of birth for me?
Yeah, Demi Nardo, 11/30/1994.
Okay, let me just check that real quick. Perfect. Okay, Demi, do you have any allergies?
No, not that I'm aware of, no.
Not that you're aware of. Okay, what about any pain at this moment?
No, I'm okay.
No? Okay, so that's good. Do you know where we're at?
Yeah, at the hospital.
Okay, do you know what year it is?
Yeah, 2018.
And who's our president?
Trump.
Okay, so patient is alert and oriented ×4, which is good. Demi, so I had my CNA perform your vital signs on you,
Yeah,
and
she did.
everything's within normal limits, which is good. So it's stable
Awesome.
as well. And she also checked your vision
Yes,
as
she
well.
did.
Okay. All right. So basically, today what we're going to be doing is we're going to be doing a head-to-toe assessment, a physical assessment on
Okay.
you, and I'm just going to be going through parts of the body, and we're just going to be assessing them and trying to see how it works. Are you feeling
Perfect.
okay? Are you
Yeah,
in any
fine.
type of mood? You're fine. Everything's okay. All right. So you look like you're in a great mood, which is good.
Thank you.
It's always good to be in a good mood. So I'm gonna just provide some privacy for you here,
Awesome, thank
so
you.
that we can get started. If you don't mind, just taking a seat
Yeah.
on the bed itself. Okay, perfect. So what I'm gonna do is I'm just gonna start with assessing your head. We're just basically looking for, equal hair distribution, no signs of alopecia, no signs of flakes, lesions, things like that. That's perfect. I'm gonna go ahead then, and I'm gonna take, your head is also normal cephalic, which is also good. I'm gonna take my pen light, I'm gonna assess your ears, I'm gonna pull it up and back. What I'm looking for here is just any signs of drainage, or occlusion, or you don't have any hearing aids, right?
No, I don't.
No hearing aids, okay,
No.
so that's good. So I'm gonna need you to close your eyes for me, and tell me if you hear this.
Yes.
Okay, do you hear this?
Yes.
Okay, now I'm gonna just whisper something, and I need you to tell me if you hear it, okay?
1, 2, 3.
Okay?
1, 2, 3.
Okay, so cranial nerve 8 is intact, which is great.
Perfect.
I'm gonna need you to then close your eyes once again for me. All right, and I'm gonna go ahead and I'm just gonna need you to tell me what you're smelling.
Coffee.
Perfect, so cranial nerve number 1 is also intact. All right, you can open your eyes now. So I'm gonna go ahead and assess your eyes
Okay.
now. So I'm gonna need you to just look at my pen, perfect. Look at my pen, perfect. So cranial nerve number 3 is intact. Pupils are equally round and reactive to light and accommodation, which is good. Oh, and then I'm gonna need you also, just follow this pen. Okay, good. So your trochlear cranial nerve is intact, which is cranial number 4. Follow my pen here. Perfect. Perfect. Okay, cranial number 6 is also intact. I'm gonna need you, Demi, to close your eyes for me as well.
Okay.
One more time. Let me know if you feel this.
Yeah, I do.
Okay, perfect. Patient's cranial nerve number 5 is intact. Demi, can you then blow up your cheeks for me? Perfect. Smile. Raise up your eyebrows. Cranial nerve number 7 is intact. Also good. Can you go ahead and then open your mouth for me, Demi, please? Perfect. Okay, good. Okay, take out your tongue. Side to side. Perfect. Alrighty, and then swallow for me. Okay, so cranial nerve number 9, number 10, and number 12 are all intact. I'm gonna need now, Demi, as well for you to shrug for me. Perfect, okay. I'm gonna also take a look inside your nose, just looking for any signs of deviation or pull-ups as well. No signs of drainage, which is good. And now what I'm gonna go ahead and start doing is I'm gonna palpate your lymph nodes, Demi. I'm gonna do the preauricular, postauricular, occipital, retropharyngeal, submandibular, submental, superficial, deep, and subclavicular. All right, so your lymph nodes seem non-palpable, which is good. They're not tender. They didn't hurt, right, when I
No.
touched anything? Okay, perfect. So now, Demi, what I'm going to go ahead is assess your carotid artery. I'm going to go ahead and listen here. Perfect. Okay, so pulse is perfect bilateral. Bilaterally, just turn your head to the side, turn your head to this side. Now I'm just assessing for signs of JVD, which is good. You have none. And I'm going to go ahead and take a listen to your carotid artery as well, okay?
Perfect.
All right. Okay. Perfect. All right. So pulse is bilateral as well. No signs of bruit on the carotid arteries, which is great. Now, Demi, can you please just stand up for me?
Yeah.
All right. So what you're gonna do is just walk towards me. Perfect. Good. Now you're gonna stand, hands by your side, close your eyes. All right. So you have a negative Rosenbaum test, which is good. All right. Take a seat for me. And now, Demi, what I'm gonna need you to do is just lay down. You can lay down.
Thank you.
And I'm gonna do a small, quick neural assessment on you. I need you with the tips of your fingers just to tap your thumb as fast as you can. Perfect, that's great. And then with the heel of this foot, I need you to bring it up to your other leg, bring it all the way down. Perfect, to your ankle, and then I'll do it again. Okay, so the neural assessment is within normal limits and it's good, so everything checks off. What we're gonna be doing now is we're gonna move down to your thoracic cage. I'm just basically looking at it, trying to see if there's symmetry. Everything is moving bilaterally, no signs of lesions, scars, or any type of trauma. Your turgor is good, which is a good sign you're not dehydrated. And then basically now what I need to do is I need you to extend your arms out. Perfect, so against gravity you're good. Push down on my hands. Perfect, push up. Perfect, now hyperextend on, flex. Okay, perfect, awesome. Alrighty, so what I'm gonna do now is I'm gonna check your reflexes, okay?
Perfect.
Alright, so Demi, like I said, I'm gonna check your reflexes. I'm gonna go ahead and check your brachioradialis first. So just relax your arm right there. Perfect. Alright, now I'm gonna check your bicep. Perfect, and now I'm just gonna go ahead and check this one here. Alright, so your reflexes are within normal limits. They're +2, which is how they're supposed to be. So now I'm going to go ahead and check your capillary refills, Demi, just to make sure that you are oxygenated and everything's flowing perfectly. Perfect, perfect. They are brisk, which is how they're supposed to be. And now I'm going to go ahead and start listening to your heart sounds, okay?
Okay, no problem.
Alright. If you don't mind just opening up the sweater a little bit for me. Alright, so I'm going to start here with the aortic. This is where we hear S2 the loudest, as well as with the pulmonic. Okay, then I'm going to go ahead and bring it into the Erb's point, but I'm going to use the bell, the stethoscope, for that. And this is the midway between both, and you should hear it basically equally, S1 and S2. And then if you don't mind raising up your breast a little, yes, perfect. Okay, now I'm going to go ahead and listen to the tricuspid. And then I'm going to listen lastly for the mitral, but I'm going to need you to extend forward or flex forward, perfect, for a minute. Okay, perfect. Your pulse is great. It's 72, which is within normal limits. Normal is 60 to 100, which is okay. All right, so what I'm going to be doing next is I'm going to be listening to your lung sounds, okay, Demi?
No
I'm
problem.
going to need you to relax and then just breathe in and out as I'm moving across, okay?
Got it.
All right. Okay. Perfect. Now I'm going to need you to sit up. I'm going to go through your back. Breathe in. Okay. 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 Perfect. All right. So breath sounds are within normal limits. Yes. No signs of any adventitious sound, which is good.
Awesome.
What we're going to do now is we're going to move down to your abdomen, and we're going to just take a look at it real quick.
No
Let me just
problem.
lower the bed for you so you can be flat
Got it.
and get comfortable. Okay. Fine? Okay, perfect. All right, so I'm just going to take a look at your abdomen, Demi. When was the last time you went to the bathroom?
Like 3 days
3
ago.
days ago. Can you
Yeah.
describe how it was or what the consistency and stuff?
I was a little constipated. It came out. It was hard. It was brown.
Okay,
Well,
and what
yeah.
about urine?
The urine? No, I don't have a problem urinating. It's
No?
clear.
Clear?
I drink a lot of fluids.
Okay, perfect. So I'm just taking a look. Now I'm just going to go ahead and auscultate.
Okay, no
I'm
problem.
going to start with the lower right quadrant.
Okay.
All right. I'm supposed to listen or stay here until I hear 5 to 35 sounds, and then I'll move up, and then across, and then back down on the left side of the quadrant, okay?
Okay.
If I don't hear anything, I have to stay in each quadrant for 5 minutes, okay?
And everything sounds good?
Everything sounds
Perfect.
good. I'm gonna go ahead and just percuss real quick as well, starting at the right lower quadrant,
Okay.
moving to the top, across, and back down.
Awesome.
Okay, I'm gonna do some light palpation. Let me know if you feel any pain, okay?
Okay.
Okay. Perfect. Perfect. And you don't have any pain upon urinating, right? No,
No.
nothing at all whatsoever?
No, urinating with the bathroom, I'm fine. It's okay.
Perfect, no problem, Demi. So I'm gonna move down then to your lower extremities, and we're just gonna check that out, and that'll be
No
the ending of
problems.
the assessment for you, okay?
All
So,
right.
Demi, what I'm gonna need you to do is actually just bring out one leg. Perfect. Put it back. Do the same with the next leg. Okay, perfect. Raise it up for me. Okay, push down on my leg. Okay, push up on it. Perfect. Same thing with this leg. Okay, perfect, Demi. I'm just gonna go ahead and assess your legs as well. What I'm looking for basically is just any signs of edema, equal hair distribution. You don't have any calf tenderness or pain on your calves, right?
No.
No, okay. Skin breakdown, none noted whatsoever. I'm gonna go ahead and need you to rotate your ankles for me as well. Perfect, okay, so the joints seem fine. And then also I'm gonna go ahead and take your pulse, okay?
All right, no problem.
All right, your dorsal pulse as well as your thalamus pulse, okay?
Okay, no problem.
Okay,
Everything's good?
everything is good. It's bilaterally,
Awesome.
which is good. And then what I'm gonna do, the last thing we're gonna do is we're just gonna check for cap refill of your toes.
Those are fine?
They're fine. And then I'm actually gonna check one last reflex of
Okay.
yours. I'm gonna need you to sit down.
Okay.
Perfect. Just lay your legs dangle, and then perfect. All right, so reflexes are within normal limits, so they're +2, which is how they're supposed to be, and pretty much that's it. Do you have any questions for me?
No, thank you for everything.
All right, thank you.